How to treat extensor tendonitis foot? If you experience pain on the top of your foot, then this is because of the inflammation of the extensor tendons, and this condition is known as extensor tendonitis. It is very common in runners and athletes. You feel pain and swelling at the top of your feet, which triggers whenever you stretch them. You can have foot extensor tendonitis due to an overuse injury, which is very common among runners. You can also have tendonitis under the skin of your hands, but it is most common at the top of the feet. The purpose of the tendons in the feet to connect the bones of the toes to the foot muscles, and whenever these tendons are damaged or hurt, then you get tendonitis of the foot. The people who perform strengthening exercises more often get extensor tendonitis because their hands and feet are frequently used in such exercises. What are the common causes of extensor tendonitis foot? Extensor tendonitis foot is very common among runners and athletes who spend too much time on their feet. If you often wear shoes that are too tight, then you can also suffer from extensor tendonitis. Studies have shown that the people who perform repetitive work, such as typing on the keyboard for a longer period of time, may get tendonitis. Athletes use their hands and fingers too much when it comes to their game, and that is why they often suffer from mallet finger, which is an injury of the damaged tendons. After performing any sports activity or repetitive work, the person experiences swelling and redness in hands and feet, which is accompanied by discomfort and pain. In such situation, you need to take an appointment from the doctor, otherwise the discomfort will increase as the time passes. How to treat extensor tendonitis foot? Extensor tendonitis foot is commonly experienced by runners and athletes who do repetitive work with their hands and feet during the game. They feel discomfort, pain, swelling, and inflammation of the feet when suffering from tendonitis foot. The doctors, after physical examination, will diagnose extensor tendonitis foot, in which they recommend the use of anti-inflammatory medicines to prevent pain. They are advised to take rest for a long period of time until the tendons are healed. The patients are also advised to go to physical therapies, which helps them to heal faster. When the tendonitis is left untreated, then it leads to tendinitis, which is a serious inflammation of the tendons that take too much time to heal. When the patient is not able to recover from medications and therapies, then the final option is surgery of tendonitis foot. What are self-treatments for tendonitis foot? The inflammation, pain, and swelling of the tendons of foot and hands lead to extensor tendonitis. The people often go for self-care treatments when it comes to healing extensor tendonitis. You need to limit your activity as much as you can, because repetitive tasks will lead to discomfort and pain that increases gradually. You can apply the cold compress for about half an hour, which will help to reduce the swelling and soreness. You can also apply an ACE wrap that helps to compress the affected area by giving it the required support. The most common way is to take anti-inflammatory medicines that help to relieve the pain.
Anyways, let me know what you think about it in the comment section below. I will see you all tomorrow. Don't forget to click the like button and share this video with your friends. Always stay tuned and subscribe to our channel by hitting the bell icon to see our latest videos. Thanks for joining us today. Thank you. Have a nice day.